Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
A couple of weeks ago, it was my brother's birthday, and he chartered a small fishing boat. And we went on the fishing boat. We were headed for a wreck off of Long Island called the USS San Diego. And it was fine when we were under power. It was a pretty long trip. It was like an hour and a half to get to the wreck. We were fine under power, but once we stopped the engine and laid the anchor, we're sitting on those swells, on those waves that are about 3 feet high, and a lot of people were turning green. And I have to tell you, my plan, I'm not really a fisherman. I was there to support my brother and to be with my family. My plan was to sit in the shade, have a nice cup of coffee, take it easy, chat with people whenever they came into the cabin. And, whenever anybody caught something, give them a nice little round of applause. In any event, I got dizzy also. Now, imagine if you got that feeling just raising your head from your pillow. Well, that's what happens to people with benign paroxysmal positional vertigo. All they have to do is tilt their head up or down, and they could get dizzy and nauseous. They could feel like the whole world is spinning around them. My name's Jerry Hickey. I'm a nutritional pharmacist. Welcome to the episode. Feeling dizzy, vitamin D might help, and so can repositioning maneuvers. We're going to discuss this over the course of this episode. So benign paroxysmal positional vertigo, moving your head makes you feel dizzy. The room is spinning around. There's a sense of movement of your surroundings, and you could get nauseous. So there's a sensation of spinning with certain head movements, usually because of a problem with your inner ear. So tilting your head up or down, lying down, turning over, getting up, all of this can trigger a dizziness attack. So can you imagine just lying down and moving your head around can make you dizzy? So it's a condition in which you have these brief but intense. That's what paroxysmal means. Benign means like it's not life-threatening, basically. Paroxysmal means intense, sudden. Positional means it depends on your position, and vertigo means dizziness. So you get these episodes of dizziness that occur when you move your head. It comes from a problem with part of the inner ear called the vestibular labyrinth. That's responsible for balance in general. Now, it's pretty common. Over a couple of 100,000 cases each year in the U.S. are reported. There's probably some that are not reported also. More likely if you're age 50 or older, more common in ladies than men. It's pretty disruptive. 85% of people who have it say it really affects their life. They miss work over it. You need to see a medical doctor if you have it, because sometimes it could be quite dangerous. There are some forms that could be very dangerous. They have to do imaging, like x-rays and lab tests. It can last a while. Now, sometimes it runs in families. If you have it severely, you need to get to an emergency room and get checked out. So these are symptoms of benign paroxysmal positional vertigo. Dizziness when you move, like if you get up from a chair or if you move your head on your pillow. A sense of movements of your surroundings, like the room spinning around, loss of balance, nausea. You might have visual disturbances, uncontrolled eye movements. We would call that nystagmus. Lightheadedness. This might only last for a minute, but it can happen frequently. Now, typically, treating it, they give you medication. They give you meclizine, which is dimenhydrinate. It's an antihistamine that's used to prevent and treat nausea, vomiting, and dizziness caused by motion sickness. It's commonly prescribed to reduce dizziness and loss of balance caused by inner ear problems. Now, the problem is all antihistamines have some level of anticholinergic effect. The drug companies don't want that, but it's just part of the structure of the antihistamine. Anticholinergic effect means it affects acetylcholine. That's bad, because that can make you drowsy. That can make your mouth dry. But also that eventually can affect your memory. If you're using these drugs all the time, it can have an effect on your memory. You can lose memory. Now, there are procedures, but they're not used very often. A semicircular canal occlusion, they use that in about 5% of severe cases. But there's canalith repositioning maneuvers that I strongly recommend. The doctor, the physical therapist provide this info. It's head movements that help you in controlling disturbances inside your inner ear. So the vertigo, the dizziness, usually comes from a problem with a part of the inner ear responsible for balance. That's your vestibular labyrinth. This type of dizziness, this vertigo, occurs when tiny particles, they're called otoconia, in one part of your inner ear break loose, and they fall into the canal of your ear, and they just throw off your balance. They're literally crystals of calcium carbonate. Now, these are normally found in parts of the ear, and they're used to activate hair cells for hearing. They're used for energy for hearing, but they're also involved with balance and like perceiving acceleration. So they determine the orientation of your body. There's these canals in your ears that point in different directions that are kind of like a carpenter's level that tell you where your body is in position to your environment, and this is disturbed. So somehow these calcium carbonate crystals have become loose, like maybe you hit your head in an accident or playing football or something. Maybe you had an infection. It can happen with aging. So there are other things that trigger it. Now, the canal repositioning procedure can move the otoconia to a part of your ear where it won't cause dizziness. You perform it in the doctor's office. It's simple head maneuvers. It's really effective. About 80% of people with this type of vertigo, it really helps them. And it might require several treatments. It might require several visits to the doctor for it to be effective. Now, if symptoms return, of course, you have to have it done. So the causes of this type of vertigo: benign, paroxysmal, positional vertigo in the inner ear. It could be family history. It could be diabetes. It could be osteoporosis. It's interesting because both diabetes and osteoporosis are related to low vitamin D activity, and vitamin D helps with this benign positional vertigo. So high blood pressure, osteoporosis, diabetes can all affect it. Head injuries, changes in your environment, like lack of sleep, stress. Now, here's some studies on vitamin D. This is clinical and experimental otorhinolaryngology, which is head, neck, and throat. It's Korean researchers. So they looked at people with this vertigo. How often did they get the vertigo, and how high was their vitamin D level? And they found that if your vitamin D level was below 15, you had a lot of episodes of this vertigo versus people where their vitamin D was above 15. We're talking about blood levels. So it really did mean something. And there's quite a few studies. I'm just looking at a couple of studies here, but there's quite a few studies showing that lacking vitamin D allows these episodes to occur more frequently. So here's Bioscience Reports. It's the Department of Neurology, Hanting District People's Hospital in China. The other study was from Korea. And it's 174 patients with this vertigo, and they're all older than 50. And they didn't look at why they had it. They looked at if they had it, how often did it recur, and what was their blood vitamin D level. And they found that in those patients who had repeat episodes of the vertigo, they were much lower in their vitamin D. And lacking vitamin D more than doubled your risk of vertigo. and increase your risk of the vertigo coming back by over 400%. I mean, there was a real tie-in. The reason I bring this up in the first place, a study just came out August 13th, yesterday. Vitamin D and calcium taken twice a day may keep vertigo away. At Seoul National University College of Medicine, it's in Neurology, the August issue of Neurology, great journal. They're looking at 1,000 people with benign paroxysmal positional vertigo. Taking vitamin D and calcium twice a day reduced the chances of getting the vertigo back by 24%. Simply taking a supplement of calcium and vitamin D in all of these people, 1,000 people, reduced their risk of having more bouts of the vertigo, of the dizziness. However, in people who were low in vitamin D in the first place, it almost cut their risk of having another episode in half. It reduced their risk by 45%. So this is something that's safe. In fact, one of the doctor's comments on that, I do believe. I don't know if I have it here. It's a very safe way of helping you deal with this kind of dizziness. Now, there's a second condition called Meniere's disease. Meniere's disease is pretty common also, over 200,000 cases a year in the United States. And it occurs in the middle ear, and it causes vertigo. But in Meniere's disease, instead of the severe dizziness lasting for just a couple of minutes, it can last 20 minutes, it can last hours. And the attacks occur frequently. I mean, these people really need to be on the meclizine or they feel terrible. The dizziness leads to nausea, vomiting, but it can damage the ears permanently. It could cause hearing loss. It could cause ringing in the ears, what we call tinnitus. There's a feeling of fullness in the ears, stuffiness in the ears. So this is the journal Medical Hypothesis. It's researchers in Austria, University Hospital Krems, Austria, their Department of Otolaryngology. That's ear, head, neck, and ear. Ear, nose, and throat, I should say. That's ear, nose, and throat medicine. But also the Vestibular Neurogenetics Laboratory, Boys Town National Research Hospital in Omaha, Nebraska. And what they found in people with Meniere's disease, which is another kind of dizziness, it's a middle ear condition, they found that normally they have to give them gentamicin, which is a pretty nasty drug. It's an antibiotic that could cause kidney damage and even hearing damage. But if they gave them vitamin D supplements, they were much less likely to need gentamicin. So they went on to say vitamin D supplementation may indeed have a beneficial effect in Meniere's disease if the symptoms are caused by a virus autoimmune reaction. So the thing, see, vitamin D is necessary for immune system function, but it's also an anti-inflammatory in the human body. That's why it could be helpful in cancer patients and in people with immune system dysfunction. The problem is, I don't think this kind of information is getting around very much. If you or someone you know has dizziness, get your blood level of vitamin D checked and get your level over 35. Now, what's a beautiful level of vitamin D in the blood? I believe between 55 and 75 is picture perfect. However, getting it above 35 is enough to help these kind of middle ear conditions. And you know what? Vitamin D is really safe. Just when you take vitamin D3, which is called cholecalciferol, is the preferred form. Don't overdo it. Don't overdo it. Too much vitamin D becomes negative, so it's a U-shaped curve. It's bad when it's low. It's also bad when it's high. You want it right in the middle. So in general, anywhere from 1,000 to 4,000 units a day, depending on the person, their genes, and how they handle vitamin D. But it's a safe way to help if you have a middle ear condition that's causing dizziness. If it helps, it's wonderful, because it certainly is not going to hurt. Okay. Thanks for tuning into the Invite Health Podcast. You can find all of our episodes for free wherever you listen to podcasts, or you could go to our website, invitehealth.com/podcast. Please subscribe. Please leave us a review. You could follow us on Facebook, Twitter, and Instagram at Invite Health. Now, before I sign off, let me give you an email address. We keep 5 nutritionists on this email address. So if you have any question on anything I said, nutrition@invitehealth.com. invitehealth.com, nutrition@invitehealth.com. In fact, let me give you my email address, jhickey, Hickey is Hickey, jhickey@invitehealth.com. So if you have any questions, just email me. You can also follow us on Facebook, Twitter, and Instagram at Invite Health. And I hope to see you another time on an episode of Invite Health Podcast. And thank you. Thank you so much for listening.